Thanks to the government of Brazil and to WHO and PAHO for organising this fantastic meeting. I'd love to share with you today a few messages that came out of a retreat earlier this month, together with 20 other organisations from across the health and climate movement. We've seen a real elevation in the way that health is stood in the UNFCCC space, COP26 health commitments, the first ever health day at COP28 and a declaration. And now we've got the Berlin Health Action Plan. All of this has built momentum on health. And now we need to translate this momentum into the negotiations. Climate change, as we all know, is the biggest threat to human health. So we have to play our part in making climate decision-making as ambitious as it possibly can be. This is decided in the UNFCCC negotiations on topics like adaptation, mitigation, loss and damage, and finance. Health is not just a side note, it has to be mainstreamed across all of the different areas of UNFCCC decision-making. Adaptation is the first area of the negotiations where we've seen a deep and dedicated focus on health. Adaptation is essential. Every part of the world is already feeling health and the other impacts of climate change, most heavily in communities that have contributed least to climate change. Indicators are being developed, the Global Goal on Adaptation. These are not just indicators for the healthcare sector, but also in health determining sectors like water and agriculture. It also matters that we as the health community are laser focused on getting the right means of implementation indicators. We can have the best health indicators in the world, but unless we've got finance and technology transfer and capacity building to build the action that's needed, they'll be entirely redundant. Even at current levels of warming, health systems are challenged. We don't know what this looks like at 2 degrees Celsius. How do we begin to plan for 3? For this reason, it's vital that we get a handle on emissions reductions. Fossil fuels are the leading driver of climate change and its health impacts, and also cause additional health harms from the moment of extraction through to combustion due to air, water, and soil pollution. At COP28, governments agreed to a just, orderly and equitable transition away from fossil fuels. The global north has to be first in phasing out existing fossil fuel infrastructure. Fossil fuel expansion has been made clear by the IEA to be out of the question, and by extension, fossil fuel exploration. In addition, we can't rely on fantasy technologies like carbon capture and storage and geoengineering. The energy sector is not the only sector in which we need to make transitions, and when we're making these transitions, we need to not only be thinking about reducing emissions, but also building resilience and adaptation, and this is covered under the Just Transition Work Programme. Just transitions are about the health and livelihoods of workers as they shift to new forms of employment, and also about ensuring access to food and energy and water, and avoiding creating new health hazards or maladapting to climate change. In terms of next steps in the UNFCCC process to facilitate these just transitions, we need technical assistance and also coordination, accompanied by principles safeguarding health. Within loss and damage, making sure that health expertise is reflected in the Santiago Network for Loss and Damage can ensure that the health needs of communities are met following climate disasters. There are 2 main issues: blocking ambitious climate decision-making and implementation. The COP29 finance outcome was gravely inadequate, both in terms of quantity and quality. Developing countries had made it clear that they required 1.3 trillion of climate finance to be able to undertake the climate action so urgently needed. However, developed countries only committed to mobilizing 300 billion. There was also no commitment to non-debt-inducing forms of climate finance. Debt reinforces cycles of poverty and disease. The poorest countries in the world are already spending more on debt service than they are on healthcare, education, and infrastructure combined. In 2022, implicit and explicit fossil fuel subsidies totaled $7 trillion, far in excess of the 1.3 trillion. Removing explicit fossil fuel subsidies and pricing fossil fuels according to their externalities could avert 1.6 million air pollution-related deaths annually. We've seen incremental progress in the UNFCCC in addressing the conflict of interest around participation by a polluting industry. At COP26, there were 500 fossil fuel lobbyists, at COP27, 600, and at COP28, 2,400. The UNFCCC process needs to take the lead from WHO processes, with one example being the Framework Convention on Tobacco Control, which explicitly excludes the tobacco industry from policy making. In closing, I want to link back to WHO's description of the Paris Agreement as a health agreement. It's our responsibility as the health community to ensure the ambitious delivery of every aspect of the Paris Agreement, from mitigation to adaptation to loss and damage and finance.